Hello, good morning. It's a Friday, the last working day of the week, and you're welcome to the AM News here on the AM Show. My name is Pakwisi Shandov. To a very first story, Medical Superintendent of the Wa Municipal Hospital, Dr. Zakaria Bukari, is worried about the downgrading of the hospital to a primary facility. He says this has led to an increase in maternal and perinatal in the area. Dr. Zakaria spoke after a charity organization under the Ahmadiyya Muslim Mission donated medical equipment to the hospital to improve health service delivery.
The Wa Municipal Hospital Medical Superintendent, Dr. Zakaria Bukari, opined that the hospital was left in a precarious situation following the opening of the Upper West Regional Hospital. He said their woes was further worsened by the downgrading of the hospital to a primary hospital with lower tariffs, and yet the challenges at the hospital ballooned.
The first time you came here, we knew the Messiah has come to help us, because it's really a problem. And I have been saying that municipal hospital, according to date of birth, is new, because there was none in this in this region. And then regional hospital is rather the old one, but has moved to a new site. But when they were moving, they never moved with the problems. They never moved with the bad infrastructure. They never moved with a bad attitude. They left it for a new hospital to come and inherit. And the little monies that we generate, because when you move the regional hospital, you are moving a secondary level hospital that has a bigger tariff when you render service. Now we have been downgraded to a primary hospital with lower tariff, but rather our problems are bigger. Having to deal with infrastructural failures, having to deal with obsolete equipment, having to deal with a lot of bad behaviors, and I think that is a very big challenge. Then I think that you came at the right time.
Speaking at a short ceremony where Humanity First, an international charity organization under the Ahmadiyya Muslim Mission, donated medical equipment valued at 180,000 Ghana cedis to the hospital, Dr. Zakaria expressed worry over the rise in maternal and perinatal deaths at the hospital within the last 6 months. He, however, was optimistic that with the donation of the specialized medical equipment to the over 60-year-old hospital, it will improve service delivery.
Because the whole region, there's no center that has more deliveries than here. Over just the weekend, we had 80 deliveries. And 80 deliveries is some of the districts, their 1 year deliveries. Even the regional hospital will not get 80 deliveries in a month. So we really get a lot of, and then basic equipments like the fetal Doppler, which is here to help. Then things like a CTG would also help to mothers that are at risk. And we see a lot of sickle cell patients, and drugs like Clexine, and those things are very important. And I think that we want to try to reduce maternal mortality.
Team leader of Humanity First UK Doctors, Dr. Azhar Sadiq, who donated the medical equipment on behalf of Humanity First, is hopeful that the equipment will enable clinicians to give better care to the people.
Notable among these are suction devices, a hearing test machine, fetal heart Doppler monitors, which will be very, very important, glucose monitoring machines, and various types of endotracheal tubes. So, we really hope that the donation of this equipment will allow the clinicians in this hospital to give better care to their patients, and together with the teaching and training that we hope to provide in the coming days, it will be hopefully a good package for them to take forward and to train their other colleagues in the future.
Humanity First is an international charity organization under the Ahmadiyya Muslim Mission and is found in 52 countries.